Hey everybody, this is Dr. Quinn here at Ozark Holistic Center, and today I wanted to talk about a cool little success story I have in the office that had to do with heart rate variability. So heart rate variability is a metric that can be tracked. Nowadays you see it, a common metric with some of the watches. Sometimes Apple Watch, I believe, runs that, and then your Oura rings and those kind of things. It's a metric that became kind of more popular with Dr. Porges's polyvagal theory that came back out in the 90s. But looking at heart rate variability as a way to determine whether the body is using it to look at the autonomic nervous system, which is your fight or flight or sympathetic nervous system, versus your rest and digest parasympathetic nervous system, and using that metric to look at where your body sits in terms of those ranges. Is it going more sympathetic, fight or flight, more rest and digest, parasympathetic? And so it's a really neat indicator for that and where the body is. So we had someone come in just a really high kind of anxiety, stress state. This is a level that they had been tracking themselves due to one of these devices, and was aware that over the past period of their lives that number had really gone up, and that they were sitting in a much higher fight or flight state, and they were working on trying to bring it down. And so it was starting to affect their sleep habits, as well as just kind of mental clarity and just the way they responded to stress. So came in for the first visit, we were able to kind of talk through that, and we started doing kind of a lot of hands-on work. With applied kinesiology, one of the things we look at is what we call trauma release work. So trying to identify where the body is holding traumas, and in terms of in muscles and joints and tension, ligaments, fascia, identifying those and releasing them out in that process. And so in that first session, that's what we worked really heavily on. Was looking at old, either physical or potentially emotional traumas, and could we release them? So going through that session, I didn't know at the time, but things finished up, and she was things were really good. She actually felt a whole lot calmer. We've since done several follow-up sessions and continued that progress, which has been really good. It wasn't until I think the third or fourth session that they came in and showed me that their chart. They had tracked this all the time. They're I just wanted to make sure that this change was actually going to happen, because that fourth visit was several weeks later. That this wasn't just a blurb on my testing, but she was able to bring in and show me her heart rate variability tracking and where the levels were. And literally in that hour's first session, her levels dropped, came down to a much calmer state, which means we were able to pull her system from running a higher sympathetic state down to more of a parasympathetic state. And then they had maintained that since then. So it literally happened in this 1 hour window of time, which was really cool for me. This is not a level that I often track or have the metrics or means to track. And so it was cool to see something that showed the improvement that was gained from going through a session here in the office and doing that kind of work of what we call trauma clearing. So it resulted in her anxiety levels coming down. They've been able to stay down, her response to stress improving, feel like she can handle more stress, and just the different things kind of going on in her life. So cool little story there. So success with heart rate variability tracking. That's something I'm now kind of looking at more, trying to figure out if we can do some of that testing here in our office to track those numbers as well. And we'll see how that comes. So thanks, guys.